My name is Lucy Rangas, a caregiving student from St. Augustine School of Nursing, Iloilo. And today, I will be performing a complete bed bath. A complete bed bath is administered in bed, usually as a part of morning care to a patient who are unable to perform for themselves. It aims to remove transient microorganisms, body secretions, excretions, and dead skin cells, to promote client or patient comfort and relaxation, to stimulate circulation to the skin, and to prevent or eliminate unpleasant body odors. The equipment needed for the complete bed bath are bath basins with warm water, linens like bath blanket, 2 bath towels, washcloth, we have gown, assuming that this is the bedpan, we have soap and soap dish, gloves, nail brush, combs, personal hygiene articles like lotion, deodorant, powder, oil, and we have thermometer, face mask, and then we have laundry basket. Wash hands before the procedure. This is to prevent cross-contamination and spread of microorganisms. Obtain the equipment needed, including the PPE such as masks and gloves. So now, it is important to a patient consent upon entering a room. Hello sir, may I come in?
Okay.
Good morning sir, my name is Lucy Rangas. I am your caregiver for today. May I know your name sir?
Chris Johnson,
When is your birthday sir?
September 1, 1980.
May I check your wristband sir? What do you want me to call you sir?
Anything you like.
So Sir Chris, I am here to provide you a complete bed bath. This is done to remove transient microorganisms, body secretion, excretion, and dead skin cells, to provide you comfort and relaxation, to stimulate circulation of your skin, and to prevent or eliminate unpleasant body odors. So is that okay with you, sir?
Okay.
Check the temperature of the patient. If the patient has fever, perform typically sponge bath instead. Sir, your temperature is about 36.6 degrees Celsius. Offer bed pad or urinal as desired. Encourage patient to urinate first before the procedure. Wash hands, then put gloves. This promotes clients' comfort during the procedure. Sir Chris, do you want to pee first or urinate before the procedure?
No.
Arrange all the articles needed within reach. Line a chair or table with a newspaper or piece of rubber or plastics where the basin is to place. Provide privacy. Drape the curtains, lock the door, or put sign outside the door. This is to ensure our clients' privacy. Close windows and air conditioning unit. This is to prevent patient from hypothermia. Invite a family member or significant other to participate if desired. So now, raise the bed at comfortable height. Raise the side rails. This promotes proper body mechanics and reduces strains on the nurse's back. The side rails will serve as a protection for the patient from falling. Loosen the top sheet. Assess the client to the side of the bed. Remove clothing or patient's gown while the top sheet is in place covering with the patient. If the patient has IV line or reduced mobility, begin with an affected area. Removing the gown, turn the client or patient towards you, then untie the gown. Position the client supine, then remove the gown by rolling it inward. So now, place the bath blanket over the top of the sheet and roll down the top sheet under the bath blanket and place it into the hamper or laundry basket. Putting bath blanket provides warmth and privacy. Okay. Fill the 2 bath basins 1/2 to 2/3 full of comfortable warm water. Combine the hot water until desired temperature is achieved. Ideally, the temperature is about 43 to 46 degrees Celsius. Warm water is used during bath for comfort, relaxes muscles, and prevent unnecessary chilling. Ask the patient to check the water temperature if he or she can tolerate it. Then, remove the pillow on the patient's conditions allows. Sir Chris, can you check the water temperature if it is warm for you?
The water is fine.
Then raise the head of the bed 30 to 45 degrees and wash the patient's face. Get the pillow on his head. Spread the bath towel across the bed under the client's or patient's head and front of the chest to provide warmth, comfort, and privacy. Wet the cloth or face towel and squeeze out excess water. Wrap the palm and fingers to form a mitt. Mitt retains water and heat better than loosely held washcloth. Start the cleaning the patient's eyes. When cleaning the eyes, wipe from inner to outer canthus with water only. Use separate section corner of the towel for each eye and dry them well. Soap may irritate the eyes. Using separate section of the mitt reduces transmission of infection. Bathing eye from inner to outer canthus prevents secretion to enter nasolacrimal duct. Okay. using the patient's face. Ask the patient if he or she wants soap to wash his or her face. Soap tends to dry face. Rinse the area 2 to 3 times if soap is applied. Sir, do you want soap to wash your face?
No.
So, wash, rinse, and dry the patient's face using a shake. Forehead, face, neck, including the back of the ears. Inverted 3 shapes. Forehead, face, neck, and back of the ears. Rinse. And dry. Remember, expose only the body part that is needed to expose to prevent from chilling. Now, wash your chest and abdomen. Spread the bath towel across the patient's chest while lowering the blanket to umbilical area. Lift the bath towel of the chest and bath the chest and abdomen using mittened hand using long firm strokes. Then, give special attention to the skin under the breast and any other skin folds, particularly if the patient is overweight. Rinse and dry them well. Wash. Soap. Rinse twice. Then dry. So now, if your patient is female, cleans and dries the skin beneath the breast and check and change the water if necessary. Scrape the patient's chest and abdomen using a towel and bath blanket. Now, washing the patient's forearm. Apply bath towel under the patient's forearm. Wash, soap, rinse, and dry the patient's forearm starting from distal to proximal to increase venous return. top, outer side, inner side, under, including the axilla. So, top, outer side, inner side, under, including axilla. Rinse 2 times. Top, outer side, inner side, under, including axilla. And dry well. Do the same on the other hand. Change the water if necessary. And dry well. Soak the patient's hand in the basin and brush the fingernails using nail brush. Do the same on the other hand. So now, washing the patient's far leg. Wash, soap, rinse, and dry the patient's far leg. Expose leg by folding bath blanket to the midline, keeping the perineum covered, and place the bath towel beneath this leg. Top, outer side, inner side, under, including the groin. So, top, outer side, inner side, under, including the groin. Rinse. Top, outer side, inner side, under, including the groin, and dry. Do the same on the other leg. Soak the patient's leg. Clean the 2 nails using nail brush. Do the same on the other leg. So now, washing the patient perineal area. Place the towel under the patient's perineal area and ask the patient to wash his own genitalia. If so, make a mitt on the patient's hand and instruct to wash his own genitalia. For female, front to back. For male, glans, penis, shaft, base, and scrotum. Sir, can you wash your own genitalia?
Yes.
To wash your genitalia, clean the gland, penis, shaft, base, and scrotum. After washing the patient's genitalia, put washcloth into a laundry basket. Get another clean washcloth. Change the water. Wash hands and put on new gloves. So now, let's proceed to wash the patient back, including buttock. Turn the patient in lateral position, facing towards you. Wash, soap, rinse, and dry the patient's back, including buttock. Pay attention in the gluteal folds. Soap, rinse twice, then dry. Soap. Rinse twice. Then dry well. Offer back massage to relax and relieve muscle tension and to stimulate blood circulation with warm lotion. Effleurage. It is a smooth long stroke moving hands up and down the back. Tapotement, also known as tapping. Petrissage, also known as kneading. Putting on new gown. Position the patient and supine and put on new gown starting from affected side. Apply ointment or oils to the skin with dry surface to prevent bed sores. Change the bath blanket with top sheets. Make the patient comfortable. Sir Chris, do you want to use powder?
No.
Sir Chris, thank you for your cooperation.
Thank you also.
Do aftercare. Return the equipment clean and functional. Document a procedure done. And perform proper hand hygiene. Now, complete bed bathing procedure has been done.